So the Center on Disability Studies has as its mission to promote interdisciplinary training, research, service, and dissemination to improve the lives of individuals with disabilities and their families. So our key objectives to that end is to partner with communities, state entities, national partners to do that work and to make sure that that is also built around the concepts of self-determination and honoring agency so that individuals with disabilities themselves and their caregivers are at the center of making those decisions and designing our work and our objectives to that end.
At the University of Hawaii, we have a statewide inclusive higher education project. So if you're a person with an intellectual disability, you can go to any of our community college campuses and we'll have support that's portable to that campus, or we'll have a person on campus to provide that support. Our support is based around an adaptive coaching model where the coaching support changes with what the student needs. As the student grows, the coaching model changes. And all of the coaching is really focused on self-determination, that ability for the student to not only get ready for and be successful in an academic setting, but also to prepare for employment and adult roles where they're the primary agent in their lives and they make the decisions that affect them.
One of the really exciting opportunities here at the Center on Disability Studies is that we do offer a Disability Studies Advanced Certificate. It has given us a tremendous opportunity to partner with other departments here in Hawaii. We have a large number of students that come from various different departments, social work, public health, College of Education, and those individuals are looking to add on to their own skill sets so that when they exit into employment, they're able to work in their respective fields with a real good grounding and understanding about how better to identify barriers to access and inclusion for individuals with disabilities and help to remove them.
The impact of our Center on Disability Studies actually is here on campus, but also just as much, if not more, in our community and beyond the state of Hawaii. So it's an arm that really touches on, yes, locally, right in our own backyard with our students here at Manoa, but it also impacts positively throughout our entire community.
The founding of the University Center on Excellence at the University of Hawaii Manoa was initially through the Hawaii State Legislature. We went through the process of becoming an actual program within the university approved by the Board of Regents as the Center on Disability Studies. And so this all occurred in the first 10 years or so of our existence. Also in that period of time, we initiated a second UCEDD, the Pacific Basin University Affiliated Program, or UCE now. We're the only center in the U.S. that runs 2 UCEs out of the same offices.
What makes ASUCEDD unique, we basically rely on each other to thrive in our community, and UCEDD has to see it from a holistic standpoint. We basically address it as a human security approach. And when I say human security, it's how do we make people with disabilities and aging feel safe and secure.
Speaking on the cultural perspective, having a disability is probably seen as something to be ashamed of, in the sense. Ashamed to an extent where some of these families don't want to seek help. You said in programs that help the disabled community can also bring awareness and empowerment to those families, just letting them realize for themselves that there is help out there and there are programs where their children or their family members can feel comfortable in or receive services from.
MFP is Money Follows the Person. It's a demonstration project that was funded by the Center for Medicaid and Medicare Services. The main goal of the project is to ensure that people who may be in a facility or an institution who have developmental disability, intellectual disability, or a physical disability, including our elderly, that they have the choice to make their own decision if they want to transition to live back in the community. So it's all about being back in home-based community services.
I commend the UCEDD for looking out for these kinds of opportunity and to enable the community to at least receive these kind of health care to make better decisions and to ease off on the pressure too with each family commitment.
Some of the ways that UCEDD provides technical assistance to the community college, the American Samoa Community College, is that especially during the time of COVID, we had a lot of assistance in the work with awareness of the importance of vaccination. The college was shut down, and during the time of the shutdown, we had to provide test kits or testing results to allow those that had essential services to come to the college. And so before they could, they had to provide negative results. UCEDD was a big part of that.